Today I want to talk about something that we see very commonly in the practice, and that is neck muscle spasm. Now, muscle spasm is defined as an involuntary, sustained contraction of one or more muscles in the cervical region. It usually happens as a protective response to irritation, overload, injury, or abnormal nerve signaling. So if we look at the different mechanisms, the first one is muscle overload. Muscle overload causes an irritation, and that triggers the nociceptors. Nociceptors is receptors in the body that will trigger a pain response. And that happens when we have poor posture, sustained forward head position due to prolonged screen time, sudden forced movements, stress, and injury. All of these cause strain on the neck muscles and strain on the microscopic muscle fibers as well as the connective tissues. They all become irritated, and that would then activate the nociceptors. In turn, this will release chemicals that sensitize nearby nerves and increase the nerve signaling to the brain. That signaling will then elicit a pain response from the brain. A second mechanism is reflex muscle contraction. So when the brain signals and activates a pain response, the body then goes into a protective reflex mode. So the nervous system increases activity in the alpha motor neurons. This causes the surrounding muscles to contract in an attempt to stabilize the cervical spine, limit movement, protect the injured tissues. And all of this is called muscle guarding reflex. Now, commonly the muscles that can be involved is the upper trapezius, the levator scapulae, the sternocleidomastoid, the splenius capitis, and paraspinal muscles. The third mechanism, it is important to remember that sustained contraction reduces blood flow. So when muscle fibers stay contracted, intramuscular pressure increases. That causes the small blood vessels to be compressed and oxygen delivery decreases. All of this produces local ischemia, and there is an accumulation of metabolic like lactic acid, hydrogen ions, and inflammatory substances. These chemicals will stimulate pain receptors even further. So we then start with pain that increase spasm, which then starts a pain cycle to develop. The combination of pain, ischemia, inflammation, and nerve sensitization creates a self-perpetuating loop. So the loop is pain, muscle contraction, reduced blood flow, metabolic buildup, more pain, and thereby more contraction. This is a classic pain cycle. Then we need to talk about the role of the nervous system. So, peripheral mechanism, local muscle spindle activity increases. The muscle spindles become hypersensitive. A stretch reflex are then exaggerated and muscle remains tight. From a central point of view, if the above mechanism peripherally is sustained, the spinal cord neurons become hyperexcitable, which will lower your pain threshold. Normal movement starts to trigger pain. This is quite important, and why chronic neck spasm can persist even after the original trigger improves or is absent. Furthermore, you get stress that will activate our sympathetic nervous system. So, psychological stress commonly contributes through an increase in the sympathetic nervous system activity, increase of muscle tone, you get jaw clenching and shoulder elevation. The upper trapezius is especially sensitive to stress and related to tension. There are other findings. On top of that, patients also experience stiffness, a decrease in cervical range of motion, muscle knots or trigger points is commonly referred to, headache, and referred pain to the shoulder or the scalp. Trigger points may produce referred pain, and this is due to the convergence of sensory pathways in the spinal cord. Common causes: poor ergonomics, whiplash, cervical disc irritation, and facet joint dysfunction. Prolonged static posture and also sleep position can contribute. So, as a summary, the mechanical or emotional stress leads to muscle fiber irritation. That leads to pain receptor activation. That in turn leads to a protective reflex contraction, which leads to a decrease in blood flow and a metabolic buildup, which cause more pain and sustained spasm. Since this is not a one-dimensional problem and it can only be addressed by working at the individual's causative mechanism, you might need to see a professional to help to solve this.